Today we will say, explain and learn how to manage headaches, back pain, and joint pain naturally, without pills. Pain is the language of the body that most people are afraid to listen to. Pain is not an enemy. It is a messenger. It says to you, stop, look at me, listen to me. The modern world tries to silence pain with a pill, an injection, or with rushing on. But pain does not want to be suppressed. Pain wants to be understood. When you turn towards it, not only does it lessen, but it often disappears, because it has already fulfilled its purpose. Headaches, back pain, or joint pain are among the most common health problems that can significantly affect the quality of your life. According to the World Health Organization, up to 40% of the world's population suffers from some form of headache. Lower back pain is even the leading cause worldwide of work incapacity and disability. In total, musculoskeletal disease, affecting joints, bones, or the spine, affects up to 1.71 billion people, which makes it the biggest contributor to disability in the world. These chronic pains lead to limited mobility and self-sufficiency, worsen quality of life, and can even shorten a person's active working life. First, I will tell you a story to begin with. A woman once came to a healer and said, "My back has been hurting for months. I have tried everything, but nothing helps." The healer put his hand on her shoulder and asked, "Whom are you carrying on your back?" The woman burst into tears. She realized that for years she had been carrying responsibility for everyone around her, but not for herself. A week later, the pain subsided. The body speaks, but it speaks the language of feelings and symbols, not words. When you learn to listen to its speech, you become your own healer. And what is the Stoic attitude to this topic? The Stoics said, "It is not pain that destroys us, but our resistance to it." When you accept pain, it does not mean giving up. It means stopping the fight with reality. Stop and say to yourself, "All right, the body is speaking up. What does it want to tell me?" A Stoic would say, "Pain is a teacher, and every teacher disappears once you have understood their lesson." Calm acceptance is the greatest analgesic we know. Another teaching, in the form of the Eastern principle, sees this topic as a call for movement and attention. In traditional Chinese medicine, it is said that pain arises when the energy chi does not flow. Where energy stagnates, there appears tension, inflammation, and fatigue. Pain is not punishment. It is a call for movement and attention. Healing does not begin with tablets, but with breath, touch, and conscious movement. When you breathe into the place of pain, it begins to open. When you send it warmth and attention, it begins to heal. The indigenous principle relies on a method known as connection with nature and its rhythm. Indigenous cultures knew that pain is not separate from nature. They said, "The earth has pain when it is dry, the tree when it is wounded, a person when they forget about movement." When your head hurts, perhaps you think too much. When your back hurts, perhaps you are carrying more than you should. When your joints hurt, perhaps you are not moving in the rhythm of life. The remedy is a return to simplicity. Movement in nature, bare feet in grass, sun on the skin, breath into the earth. And now let us look at 12 specific types of complications or illnesses that can relate to headaches, back pain, and joint pain. Pain as such is often a symptom of another illness. Now we will show an overview of the main diseases and complications that relate to recurring headaches, back pain, or joint pain. These include both primary illnesses that cause pain and complications that can develop from long-term pain. Complications: illnesses caused by headache. Illness, complication. Number 1, migraine. This is a neurological illness with complex triggers such as stress, hormones, certain foods, and others. In sensitive people, it recurs again and again throughout life. Illness, complication. Number 2, tension-type headaches. This is the most common type of primary headache. It presents as diffuse pressure or tightness around the whole head or forehead, often radiating into the neck. It is usually triggered by stress, psychological tension, or muscular overload of the neck and nape area. Illness, complication. Number 3, cluster headaches. These are accompanied by very intense, sharp pain, usually around one eye, accompanied by tearing, redness of the eye, and nasal congestion on the affected side. Attacks are relatively short, from tens of minutes up to 3 hours, but they can repeat several times a day. Illness, complication. Number 4, medication overuse headaches. Headache from overuse of pain medication. It develops in people who take painkillers for headaches frequently and over a long period. The body becomes used to frequent doses, and when the level of the medicine drops, the headache appears again, which leads to a vicious circle. Among other causes of headaches, we include inflammations of the paranasal sinuses, with typical pressure in the forehead and cheeks, temporomandibular joint disorder radiating into the temples, high blood pressure, or a brain tumor. Untreated chronic headaches can lead to insomnia, anxiety, or depression. Complications: illnesses caused by back pain. Illness, complication. Number 1, degenerative diseases of the spine. For example, wear of vertebrae and facet joints due to age and load, or disc syndrome such as a herniated or degenerated intervertebral disc. Degenerative changes also contribute to narrowing of the spinal canal, which can lead to pain and tingling radiating into the limbs. Illness, complication. Number 2, myofascial pain syndrome of the back. This is a functional disorder characterized by persistent, painful knots in the back muscles, which are tight and tender. These points often arise from long-term muscle overload, for example from poor posture or stress. Myofascial syndrome significantly contributes to chronic pain in both the lower and upper back. Illness, complication. Number 3, inflammatory and autoimmune diseases of the spine. Here we include, for example, ankylosing spondylitis, also called Bechtereau's disease, an autoimmune inflammation affecting joints and the spine, leading to back pain and gradual stiffening of the spine in a bent forward position. Illness. Number 4, osteoporosis and vertebral fractures. Here we speak about bone thinning in older people, especially in women after menopause. A bone fracture causes sudden severe back pain and can lead to chronic pain and deformity of the spine, that is, to a hunched back. Among other causes of back pain, we include scoliosis, that is, sideways curvature of the spine, spondylolisthesis, that is, slippage of one vertebra relative to the neighboring vertebra. More rarely, back pain can also signal tumor diseases. Chronic back pain often leads to the development of depression, anxiety, and sleep disorders. These appear in up to half of patients with long-term back pain. Complications: illnesses caused by joint pain. Illness, complication. Number 1, osteoarthritis, arthrosis. This is a degenerative, non-inflammatory disease of the joints caused by wear and tear of the cartilage. It most often affects the knees, hips, small joints of the hands, or the spine. It presents as pain that worsens with load, crepitus in the joint, and gradually limited range of motion. Arthrosis is the most common cause of chronic joint pain in older people. Illness. Complication number 2. Rheumatoid arthritis. Here we speak about an autoimmune inflammation affecting the lining of joints. It typically starts symmetrically in small joints of the hands and feet. It causes rest pain, mainly in the morning, prolonged morning stiffness of the joints, and gradual deformities of the joints. Illness. Complication number 3. Gout. Gout is a metabolic disease in which uric acid accumulates in the body. Urate crystals are deposited in the joints, most often at the base of the big toe, and trigger an acute inflammatory attack with severe pain, redness, and swelling of the joint. Illness. Complication number 4. Inflammatory autoimmune connective tissue diseases. Here we include systemic lupus, erythematosus, psoriatic arthritis associated with psoriasis, reactive arthritis, which usually appears after an infection, and others. These diseases often have, in addition to joint pain, general symptoms such as fatigue and skin rashes. Among other causes of joint pain, we include, for example, traumatic joint injuries, sports injuries, or chronic overloading of joints. A person with painful joints moves less, which can contribute to overweight, worsening of diabetes or heart diseases. Therefore, it is important to prevent joint pain as much as possible and to actively address problems that have already arisen. The good news, however, is that with regular movement it is possible not only to prevent these health consequences, but in many cases also to relieve or even reverse them if they have already developed. What do you think? It really is many different diseases and complications that can arise because of neglected activities and neglected measures to protect your joints, back, spine, and your overall health. So what now? Will you still hesitate? Or will you go straight to it? And start thinking about what to do so that such states and complications do not arise at all? Or if you already have them, so that you start dealing with them right away? If you want to go, so to speak, straight to it, I have here for you concrete recommendations and exercises. Keep watching the following chapters of this video. And what practical recommendations do I have for you? Here are 15 effective, concrete, and practical recommendations, tips, for natural ways of dealing with and relieving back, head, and joint pain, even without the use of medications. There are many proven methods that can help you. However, with this, we are in no way calling on you to completely exclude medical and professional care. If your pain is very frequent or is getting worse, always consult it with a doctor. 5 concrete recommendations. Tips for relief from headaches without pills. Recommendation. Tip number 1. Cold or warm compresses. Use a cold compress, which will help you especially with migraine. A warm compress or warmed nape can help you with tension-type headaches. Recommendation. Tip number 2. Hydration and caffeine in a small dose. If you have a headache, try first to drink some water. Relief often comes within half an hour. A cup of coffee or tea can also help you. A small amount of caffeine, about 100 milligrams, which corresponds to 1 small coffee, can reduce or shorten headache, especially in migraine. Recommendation. Tip number 3. Gentle stretching, movement, and massage. Paradoxically, light exercise can help you with headaches. especially if it is a tension-type headache from the cervical spine or stress. Stretch your neck and shoulders. You will thus relax your tense nape muscles. When a headache is starting, a short walk in fresh air sometimes helps, or at least airing the room, and a gentle massage of the temples, forehead or nape helps your headache. Ideally, ask your partner, or you can massage acupressure points yourself. For example, gentle circular pressure in the hollow between the eyebrows or on the temples. Recommendation. Tip number 4. Relaxation and breathing techniques. Try, for example, deep abdominal breathing. Focus on slow breathing, which calms your nervous system. Another method is progressive muscle relaxation. Gradually, consciously tighten and relax individual muscle groups from the feet to the head. Recommendation. Tip number 5. Limit excessive visual strain. Limit long periods of looking at a monitor, reading, or strong light. 5 concrete recommendations. Tips for relief from back pain without pills. Recommendation. Tip number 1. Therapeutic movement and rehabilitation. Exercise is the basic pillar in managing chronic back pain. For example, strengthening the deep stabilizing system, stretching and improving flexibility. Practicing correct posture and movement ergonomics is also crucial. Recommendation. Tip number 2. Gentle physical activity. Be active in everyday life. Do low-impact aerobics activities. For example, walking, swimming, or cycling, or using an exercise bike. Possibly Nordic walking. Recommendation. Tip number 3. Ergonomic adjustments and correct habits. Take care to maintain proper ergonomics in all activities you do. When sitting, use a chair with lumbar support. Keep your feet on the floor and your knees at a right angle. When looking at a screen, keep it at eye level. When standing for a long time, distribute your weight on both legs or step alternately. If you lift heavy loads, always lift them with a straight back from a squat. When sleeping, have a quality mattress and pillow matching your sleeping position. When walking, wear comfortable shoes. High heels worsen the curvature of your spine. All these small changes will help you significantly reduce everyday overloading of your back. Recommendation. Tip number 4. Heat and cold. With acute pain, alternate cold and heat. Apply this recommendation immediately after overload or a minor injury in the acute phase. For example, apply an ice pack for 10 to 15 minutes to reduce inflammation and swelling. On the other hand, with chronic muscular pain, use, for example, a warm shower, an electric heating pad, or a warming patch. You can also do gentle stretching in warm water. Recommendation. Tip number 5. Alternative and complementary therapies. Treat yourself to frequent massages according to your possibilities. Consider acupuncture or chiropractic or osteopathy. Explore the possibilities of cupping therapy, acupressure, or application of healing ointments. 5 concrete recommendations. Tips for relief from joint pain without pills. Recommendation. Tip number 1. Reducing load on joints, adjusting weight and unloading. Reduce your body weight, that is, reduce your overweight. Losing every 5 kilograms can reduce pain in knees affected by arthrosis by up to 50%. Use a walking cane. You will reduce your load by 20 to 30% and relieve your joints. Also use braces or elastic bandages that stabilize the joint. Recommendation. Tip number 2. Regular exercise and movement therapy. Set targeted movement into your daily schedule. It will help you reduce joint pain. Do low-impact aerobics activities such as walking, swimming, or water aerobics, cycling or exercise bike, yoga or tai chi. Perform gentle stretching exercises every day, for example, ankle circles, wrist circles, slow bending and straightening of the joints. The rule, use it or lose it, always applies. A joint that you use will preserve its function, whereas a joint that you do not use will stiffen. Long-term inactivity harms joints. Recommendation, tip number 3, anti-inflammatory diet and joint nutrition. Watch what you eat. What you eat can influence the level of inflammation in your body and therefore joint pain, especially in arthritis. Very beneficial is a diet rich in omega-3 fatty acids, for example, fatty fish such as salmon and mackerel, flax and chia seeds or walnuts. Eat plenty of vegetables and fruit. They contain antioxidants that help protect your tissues and can slow down cartilage degeneration. Some kinds of fruit such as blueberries, cherries, or citrus fruits also have mild anti-inflammatory effects. Certainly limit industrially processed foods and trans fats, for example, fast food meals and excess sugar. These components contribute to general inflammation in the body and can worsen pain. Maintain proper fluid intake. Sufficient water supports joint lubrication, and in arthritis makes metabolism of inflammatory substances easier. Recommendation, tip number 4, lifestyle adjustments and care for joints. Protect affected joints from overload, but at the same time exercise them appropriately. Alternate positions while working, standing and sitting. Use ergonomic aids, for example, soft pads under your knees when kneeling, a shopping trolley instead of carrying heavy bags, an ergonomic mouse for the PC, good shock-absorbent shoes, and so on. Rest when needed, but avoid long immobilization of the joint. Recommendation, tip number 5, psyche and joint pain. Learn to manage stress and emotions better, for example, through meditation, yoga, or breathing exercises. Maintain social contacts and hobbies. They will take your attention away from pain and improve your mood. Treat yourself to quality self-care, such as a warm bath, enough rest, or healing compresses. The best treatment is your quality prevention. Build such lifestyle habits that minimize the risk of the problems mentioned. Let us now look at practical exercises that will help you. Here are 5 simple and practical exercises for every day, for your prevention and relief. Physical exercises are one of the most effective tools for preventing headaches, back pain, and joint pain, including relief from problems that have already developed. The following 5 simple exercises can be done every day at home or in the office without special equipment. These exercises are chosen with regard to their comprehensive benefit. They stretch stiff areas, strengthen weakened muscles, and improve your posture. When exercising, pay attention to correct technique and regular breathing. Perform each exercise slowly and smoothly, and never through sharp pain. Exercise number 1. Stretching of the cervical spine and shoulders, side bends, backward bends, and tucking the chin. The aim of this exercise is to teach you to regularly stretch your cervical spine. Sit down or stand up straight. First, tilt your head towards your right shoulder, as if you wanted to touch your shoulder with your ear. You will feel a stretch on the left side of your neck. Hold for 15 seconds. Slowly return and do a side bend to the left shoulder. Then do rotations of the head. Look to the right behind you. Hold for 10 seconds. Then look to the left. Next, do a backward and forward bend of the head. Slowly lean back. Look at the ceiling. Do not overstrain yourself. Return from the backward bend, and then bend your chin to your chest. Thus, you stretch your nape. Exercise several times a day. If you have a sedentary job, do several movements every hour, altogether at least 10 minutes a day or more, according to your possibilities. This exercise will help you release tension in your neck and shoulders, prevents tension-type headaches, and helps you prevent neck pain from working at the computer. Exercise number 2, cat back, stretching exercise for the whole spine. The aim of this exercise is to teach you to stretch your entire spine effectively. Kneel on all fours, hands at shoulder width, knees at hip width. Slowly arch your entire back upwards. Pull the spine towards the ceiling. Lower your head, chin to chest. Hold for 3 seconds. Then smoothly move into the opposite position. Sag your back down. Push your abdomen towards the mat and raise your head up. Look upwards. In this way, you bend the spine into an arch downward. Again, hold for 3 seconds. Exercise daily, ideally in the morning after waking up and in the evening before sleep. Repeat the exercise slowly, 5 to 10 times. This exercise will help you mobilize your spine. It increases its flexibility, stretches your muscles around the spine, and releases your facet joints. Regular performance of this exercise helps prevent back pain and improves your posture. Exercise number 3, bridge, strengthening the glutes and back for spinal stability. The aim of this exercise is to teach you to regularly strengthen your glutes and stabilize your spine. Lie on your back, bend your knees, place your feet on the floor at hip width, arms relaxed alongside your body. Tighten your abdomen and slowly lift your pelvis and trunk upwards so that your body forms a straight line from knees to shoulders. Do not overstrain your neck. Support yourself on your shoulders. In the top position, tighten your glutes. Hold for at least 3 deep inhales and exhales. Then slowly lower your trunk back down, vertebra by vertebra. Exercise daily with at least 5 repetitions. Over time, increase to 10 to 15 repetitions. If you want a more demanding version of this exercise with one leg extended only. Single leg hold, then change legs. Do 1 to 2 sets a day. This exercise will help you strengthen your gluteal muscles, the back of your thighs and spinal extensors. These areas tend to be weak with a sedentary lifestyle, and their strengthening relieves the lumbar spine. At the same time, this exercise stretches the front of the hips, which improves the crossed pelvic syndrome, a common cause of back pain in sedentary work. This exercise also strengthens your core and supports correct posture. Exercise number 4, pulling knees to the chest, stretching the lumbar spine and hips. The aim of this exercise is to teach you to regularly stretch your lumbar spine and hips. Lie on your back, bend your knees, then grasp one knee with both hands and slowly pull it towards your chest. The other leg remains bent on the floor. Pull only so much that you feel a pleasant stretch in the lower back and glutes, not pain. Hold for about 5 seconds, then return the leg and do the same with the other leg. Then pull both knees at the same time and gently rock from side to side. You are thus massaging the sacral area. Exercise daily, at least 5 minutes. Repeat the whole cycle at least 5 times. This exercise is simple and very effective, suitable even for people who are overweight. If you are overweight, use a towel hooked behind the knee to help you if your hands cannot reach the knee. This exercise will help you release your lumbar spine, relieve your discs, and stretch your muscles around the sacrum. It is very suitable for stiffness in the lower back, especially after long sitting or strain. Perform this exercise regularly. You will improve mobility of your hips and lumbar spine, thus preventing back pain. Exercise number 5. Correct posture. Scapular pulls, strengthening the muscles between the shoulder blades. The aim of this exercise is to teach you correct posture automatically throughout the whole day. Sit on a chair without a backrest or stand. Standing variant. Let your arms hang freely alongside your body. Pull your shoulder blades together and down as if you wanted to hold a pencil between them. At the same time, push your shoulders down away from your ears. Hold for 5 seconds, then relax. Seated variant. Place your palms on your thighs, and when pulling the shoulder blades together, also press your palms into your thighs. In this way, you additionally activate the latissimus dorsi muscle. Variant for advanced users. Take a resistance band, hold it with both hands, with arms extended in front of you, and pull it apart, shoulder blades together. This further strengthens your shoulders. Exercise daily at least 10 minutes in total. You can do the exercise anywhere during the day. For example, while sitting at the PC. Several times every hour, press the shoulder blades together. In each exercise, repeat 10 times. Strong muscles between the shoulder blades are the foundation of your healthy back and cervical spine, and will work preventively against pain in your back and head. And what is the closing thought of this video? Pain as such is a part of life, but it does not have to be your enemy. Headaches, back pain, and joint pain can significantly worsen the quality of your life. But as we have shown, there is a whole range of natural ways to face these pains and to prevent them. The key is to understand the causes, to know what triggers these pains, and then to implement preventive measures into everyday life. A healthy lifestyle, regular movement, correct ergonomics, and care for mental well-being, all this together forms the best defense against chronic pain. And therefore, do not suppress pain, transform it into understanding. When you listen to it, it turns into a teacher. When you ignore it, it becomes a punishment. Learn to perceive pain as a signal, as an invitation to balance. Breathe, move, warm, listen. Your strength is not in enduring pain, but in understanding its language. And perhaps one day you will find that the pain you once hated was the very first sign of your healing. Take a deep breath and let everything you've just heard settle for a moment. Every word, every image that spoke to you today has the power to change the way you see yourself and the world around you. Remember, the strength, the calm, and the balance you're searching for have always been within you. You just need to return to them. If this video inspired you, give it a like and help these ideas reach others who might need them right now. Subscribe to the channel My Life in My Hands so you won't miss the next step on this journey. A journey toward a conscious, peaceful, and powerful life. And if you're ready to go deeper, watch the next video waiting for you right here. Because with every step forward, you discover more of who you truly are. Never forget, your life is truly in your hands.